Okay, so we'll just wipe your numbing cream off, Josh. So with Josh, we're addressing acne scarring on the face. He had acne as a kid. Did you have anything special for it? Like?
Not really, no.
Just mild acne that settled down, but everyone ends up with a bit of scarring after acne. This is also going to minimise his pore size, hopefully smooth out some of those lumpy, bumpy little bits of residual acne he's still got. And we'll address any areas where we've got scarring with a slightly deeper depth of Dermapen penetration. So he's had his local anaesthetic cream on for a period of about half an hour or so, I think. All right. Okay, Holly, so we're going to put some hyaluronic acid gel on to help the pen glide easily. We'll start with a depth of 0.5 and a speed of 4. And always remember to take the cap off. Okay. It's good. Stretch, keep the skin on a stretch when you're doing your Dermapen. And just like we do with our derma rollers, 3 different passes. How are you feeling, Josh?
That's good.
As it passes over the areas where the nerve foramens are, you can get a bit of a zing. Warn the patients they can expect that. You're just aware of it, doesn't really hurt. And we really want to keep going until we start to see a little bit of that flushing happening in the skin. You can see there's a little bit of pinpoint bleeding already from that 0.5mm depth. And just work each segment of the face like you would a chemical peel in the sort of cosmetic units. So most of our patients with Dermapen, we advise them to come back for some repeat photos after 3 to 4 weeks to see what the effects are and decide whether they need another treatment. If you've got significant acne scarring, it's probably advisable that you have a series of up to 3 treatments based about 3 to 4 weeks apart. Minor scarring, a lot of patients are happy with just 1 treatment. But you've really got to warn the patient that there's a period of time of skin reconditioning that goes on, improvement in the collagen over a period of time, so you've got to be a bit patient with it and give it that sort of 3 to 4 weeks before you assess the need for a further treatment. So you can see where the active, some little papules are, there's a little bit more pinpoint bruising. Warn the patients that in the areas where there may be some scars that they'll notice the bleeding, the microhemorrhages is a bit more obvious, but that's fine, it'll settle down after about 48 hours. Foreheads can be a bit more confronting, they can feel there's not much between the skin and the bone, so you really don't need to go more than 0.5mm depth in the forehead. And obviously it's good to address the sort of lines around here. They're not going to warn people this Dermapen does not get rid of action wrinkle lines, but it can help soften some of the early fine lines we get as a result of sun damage with age. Okay, we'll do the nose. So you can see how he's getting a nice rosy glow at the end of this treatment, which means it's had a good penetrative effect. And noses are good to do to help their pore minimisation. Okay, on the other side. Great, and I'll just get you to rear up with your upper lip, okay? Can we do the upper lip? That's great. Right, so we've done the whole face at 0.5mm depth. What I might do is dial up to 1mm depth and just address perhaps an area where I saw a little bit of scarring. It feels a bit, can you feel that deeper? It's a bit more prickly. And so you can see that the microhemorrhage is going to be a bit more apparent where you dial up that depth a bit more. And other side, it's just a few tiny little, very shallow scars from acne from his teenage years that will just help improve around this area. Okay, and that should probably suffice, I think. Okay, just wipe it down. Following this treatment, we'll get him to go under the red light, 630 nanometers, to aid that sort of healing process and minimise any sort of bruising or problems he might get from the Dermapen. But most people, after a Dermapen treatment, can go back to work the next day without any major downtime. So you can resume your normal activities after about 24 hours and face the public. Okay.